Abnormal uterine bleeding, or AUB, is a common condition that affects between 0 to 30% of women at some point in their lives. While it can occur for many reasons, it's important to understand what qualifies as abnormal bleeding and the potential causes. In this video, we'll explore the basics of abnormal uterine bleeding, common causes, diagnostic procedures, and available treatment options. First, let's define what constitutes normal bleeding. Normal menstrual bleeding typically ranges from 5 to 80 milliliters in volume and lasts around 4.5 to 8 days. Any bleeding outside of this range could be considered abnormal and should be evaluated. When abnormal bleeding occurs, there are several potential causes that should be considered. These include polyps, which are growths in the uterine lining, adenomyosis, where tissue from the uterine lining grows into the muscular wall of the uterus, and leiomyoma, also known as fibroids, which are non-cancerous growths of the uterine muscle. Malignancy, or cancer, is another important consideration, particularly in older women. Coagulopathy, or blood clotting disorders, can also lead to abnormal bleeding. Ovulatory dysfunction, which involves irregular ovulation often seen in conditions like polycystic ovary syndrome or PCOS, can contribute to this issue as well. Endometrial problems, such as abnormalities with the uterine lining and iatrogenic causes, meaning bleeding due to medical treatments or devices, should also be considered. One way to remember these causes is through the acronym POMCOAN. The P stands for polyps, A for adenomyosis, L for leiomyoma, M for malignancy, C for coagulopathy, O for ovulatory dysfunction, E for endometrial issues, I for iatrogenic causes, and N for those not otherwise classified. When you seek medical attention for abnormal uterine bleeding, your doctor will start by gathering a thorough history, focusing on your bleeding patterns and any other relevant symptoms. A physical examination may also be conducted to assess for any obvious signs of abnormalities. In addition to this, your doctor will likely order lab tests. These tests typically include a pregnancy test, a complete blood count, or CBC, to check for anemia, and thyroid hormone levels, or TSH, to rule out thyroid dysfunction. For women over 45 or younger women with a history of unopposed estrogen exposure, an endometrial biopsy may be recommended to assess for any potential malignancy due to the increased risk of endometrial cancer. Imaging, such as an ultrasound, is also common to get a clearer view of the uterus and any structural abnormalities. Treatment for abnormal uterine bleeding will largely depend on the underlying cause and the severity of the bleeding. The most crucial factor is whether the bleeding is stable or unstable. If the bleeding is unstable, meaning the patient is hypotensive or severely anemic, more immediate interventions are required. In these cases, treatments like IV estrogen or surgical options may be necessary to stabilize the patient. For women whose bleeding is more manageable, a range of medications may be used to regulate the bleeding. Hormonal treatments such as oral contraceptives, the Depo-Provera shot, or an IUD, intrauterine device, are commonly prescribed. Additionally, non-hormonal options like NSAIDs, for example naproxen or tranexamic acid, also known as TXA, can help reduce bleeding. These medications are often preferred in women who may be trying to conceive, as they are generally safer in terms of fertility preservation. There are only 2 grade A recommendations for long-term management of abnormal uterine bleeding. These are hysterectomy. This is a highly effective treatment, especially for women who no longer desire fertility or whose bleeding is severe and unmanageable. IUD Mirena. This intrauterine device, which releases progestin, is highly effective in managing abnormal bleeding. However, it's important to consider any contraindications, such as a history of breast cancer, which may prevent its use. Abnormal uterine bleeding is a common and often manageable condition, but it requires careful evaluation to determine the underlying cause. Understanding the causes, diagnostic steps, and treatment options can help women make informed decisions about their health. If you're experiencing abnormal bleeding, it's important to consult with a healthcare provider to determine the best course of action for your individual situation.